Hello friends, this is Dr. Sandeep Roy. I am the founder chairman of the Indian Institute of Integrative Oncology, also known as the IIIO. We practice integrative oncology, which is supposed to mean that we integrate all systems of medicine, specifically mistletoe therapy, which can be used as a complementary or as an alternative treatment for cancer. Mistletoe therapy can be used at any and every stage, starting from stage 1 to stage 4. There are several research papers and clinical trials. To be precise, there are about more than 150 clinical trials and more than 5,000 research papers to its credit. Most of these researchers have been done in Europe and US. A third stage clinical trial for bladder cancer is underway in Germany. The Johns Hopkins Institute of America is also conducting a stage 2 clinical trial. So, hundreds of clinical trials and thousands of research works have already been finished and published in reputed medical journals. Mistletoe is a semi-parasitic plant which grows on various trees. The basic contents of mistletoe are lectin, viscotoxin and polysaccharides. Now, these three contents are responsible for the induction of apoptosis, that is, and improving your immunity, that is, killing the cancer cells of the patient and improving his quality of life. What are the effects of mistletoe therapy? Mistletoe therapy improves the quality of life and increases the span of life even in last stage of cancer patients. There are several cases where the patients were told that they won't be able to survive for more than a few days or a few months, but the patients went on to live for years together with a good quality of life, doing what they used to do, playing with their families and spending happy moments with the families. Mistletoe therapy is a safe, non-toxic therapy. Those are oral tablets working as good as chemo, can be taken with chemo, can be taken without chemo, works as a supportive mode of treatment as well. Mistletoe can be given to children, to lactating mothers, to pregnant ladies, to old age patients, senile patients. Mistletoe can be given to patients who are not eligible for conventional mode of treatments or who do not wish to go for the conventional mode of treatments. Mistletoe therapy, when a patient is diagnosed with cancer and he does not wish to go for the conventional treatment or is not eligible for the conventional treatment, these patients land up having something which is unscientific or unproven. So for these patients, we cannot just let them die. They have all the rights to live and live a healthy, happy life with their families. So here is something which is widely used in all over Europe, all over the United States and other countries. In India, it is relatively new at a nascent stage. Hence, the awareness is a little less. Mistletoe will also increase the immunity of the patients. Now, what happens in the other modes of treatment that we decrease the immunity of the patient? Why don't we signal the body to improve its own immunity and fight for itself? Like for if it is a blood cancer patient, we decrease the immunity and the body is not producing good cells. Whereas what we should do is we should increase the immunity and tell the body to produce its own normal cells, train the body to produce its own normal cells. This is how a treatment should work. With due respect to all other treatments and therapies, mistletoe is something that each and every patient should try, maybe with or without the conventional mode of treatments. Mistletoe is a very safe medicine but should be taken under strict medical supervision, because although it is a safe therapy, but which variant is suitable for which kind of patients, what is the indication of each variant. Mistletoe is not one drug, there are several. There are around 1800 kinds of mistletoe variants available, of which some of them are clinically proven to have a good effect on cancer, or in other words, you can say that few variants of mistletoe have the anti-cancer properties, the cancer killing properties. So it should be under strict medical supervision.